So when patients say, I don't feel like myself, like what's an example of like, how you might address that, the kind of things you might find in a patient who says, I just don't feel like myself? Because it's such a vague complaint, right? It's so hard to sort of know where that can lead.
Right. So just like, we're taught in medical school, you kind of start with the broad questions and try to narrow it in. So, what do you mean by that? And then we kind of get into, okay, is it the fatigue? And are you feeling that all the time? Are you feeling that at certain parts of your cycle? When we're talking about, low libido or not being interested in your partner, I mean, some of that is maybe you just don't like a partner, but some of that is, hormonal changes and genitourinary syndrome of menopause and pain with sex. And so it's really that I'm getting into like asking each of those questions. And honestly, when you start diving into it, you'll realize that it really does affect every part of their body. So they may be having headaches, they may be having joint pains, they're having, more depression, more anxiety, they're having hot flushes, they're having weight gain. That's one that I hear a lot. Everybody's worried about the weight gain around the abdomen, which is, that more kind of central obesity we always hear about. That becomes an issue a lot. I have so many women that come to me and they say, like I just turned 40 or I just turned 45 or I just turned 50 and I'm doing all of the same things and I'm gaining all of this weight and I just don't feel like getting out of bed anymore. So those are the types of things that we hear a lot. And so a lot of it is just reassurance in the first part of things, just telling people, okay, you're not going crazy. Your body's not, abandoning you, but that this is a change and this is a change that's as big as puberty. And once I can start to, have people assess it in that way, they're like, oh yeah, like my body changed pretty drastically and permanently in puberty. And everybody sort of expected that change and they knew that they were going to go through it. But for some reason, I think because menopause, and luckily we're talking about menopause a lot more now in these last, year or two. But, menopause for such a long time has been something that hasn't been talked about, has been completely ignored. So many people are shocked when they get there. And no matter what the age of the patient, I always hear them saying, oh, but I'm too young for this. I can't be going through this. And really, those perimenopausal changes can start as early as the mid-30s, even in normal menopause, let alone, like premature ovarian insufficiency and things like that. So, you really just have to have an ear for it and think about, what could be going on. Lab tests can be helpful, but they're not that great. And so it's really like listening to the complaints and trying to work people through that.